Over 20 years, researchers tracked 30,000 adults to test a simple daily habit. The results showed a 35% drop in heart disease risk, all through the biology of intense heat and deep water pressure. Most of us think of taking a bath as either a basic chore to get clean or a rare, luxurious spa treat. We don't usually view the porcelain tub as a piece of clinical medical equipment. When discussing global heart disease, the conversation usually ends with diet and exercise. Yet a highly effective, completely passive tool sits entirely unused in millions of homes. Examining the clinical data behind deep water immersion reveals a powerful cardiovascular defense strategy, one that requires exactly zero physical exertion. In 1990, the Japan Public Health Center initiated a massive cohort study, tracking the health outcomes of over 30,000 healthy adults for 2 decades. Researchers wanted to measure the long-term effects of a specific culturally ingrained habit, relaxing in traditional Japanese tubs, built specifically for deep shoulder-depth immersion. This chart compares bathing frequency and cardiovascular health. Daily bathers saw 28% less cardiovascular disease, 35% less coronary heart disease, and a 46% drop in hemorrhages. After excluding early illnesses, this steep risk reduction remained entirely intact. 2 decades of precise tracking demonstrate that frequent deep water bathing actively protects the brain and heart from catastrophic failure. To understand how sitting perfectly still yields these results, we have to look at the biomechanics of a bath. Submersion acts as a passive workout driven by 2 physical forces. The first is thermodynamics. As the surrounding hot water raises your core body temperature, your system urgently attempts to dissipate that heat to cool itself down. This thermal exposure triggers a specific heat shock protein. It prompts the inner walls of your blood vessels to release a molecule called nitric oxide directly into the bloodstream. This forces the smooth muscle to physically relax and widen, a process known as vasorelaxation. Wider vessels offer far less mechanical resistance. Your heart doesn't have to work nearly as hard to push blood through the body, which directly lowers dangerous resting blood pressure. The second biomechanical force at play is hydrostatic pressure, the literal physical weight of the surrounding water pressing against your skin. When you sink down to shoulder depth, the mass of the water acts like a full-body compression suit, tightly squeezing your arms and legs. This sustained mechanical pressure displaces blood pooling in the extremities, forcing it upward into the central chest cavity. This sudden surge increases your stroke volume, forcing the heart to expand and pump a larger volume of blood with every single contraction. Combining heat-widened vessels with pressure-boosted pumping creates an optimal hemodynamic environment. The tub is effectively training the cardiovascular system while your skeletal muscles remain completely at rest. Translating 20 years of clinical observation into an actionable routine allows you to safely replicate these exact cardiovascular benefits at home. Look at this schedule. Maximum benefit comes from almost daily immersion, though 3 to 4 times a week still provides robust defense. Furthermore, pushing the water temperature to 42 degrees Celsius yields a 35% drop in coronary heart disease. However, this protocol requires strict safety guardrails. In Japan, roughly 19,000 bath-related deaths occur annually, driven primarily by heat stroke or drowning among the elderly. To safely manage rapid changes in your blood pressure, you must stay hydrated, avoid freezing rooms before scalding baths, and always stand up slowly. Because deep water immersion alters your heart rate and blood pressure so effectively, it acts as a genuine physiological stressor. It demands the same respect as a strenuous workout. Habitual tub bathing serves as a potent, clinically validated medical tool for maintaining long-term health. By utilizing hydrostatic compression and heat-induced nitric oxide release, a hot bath acts as an incredibly efficient passive workout for your circulatory system. Adopting this protocol consistently lowers your long-term risk of severe chronic hypertension, devastating fatal strokes, and sudden heart failure. You now have a scientifically rigorous, completely validated reason to fill the tub tonight, lay back, and protect your heart.